The doctor made it sound like we were going to take a walk in the park.
He felt great right away.
And you can't tell me I just had open heart surgery, because I never would have ever guessed I could be officiating another game 8 weeks later.
The patients that were getting it were doing so well, I almost felt it was wrong not to do it for them.
My name is Donald McCarthy. I'm a month and a half out of open heart surgery.
My name is Sean Murphy. I had triple bypass surgery 1 year ago, and I feel amazing. I was having some issues with my chest, some pressure. Luckily, a friend of mine who's a cardiologist got me in for a stress test, and I mistakenly told him, I said, I can't come in the next day, I have to go referee a game. He says, you're not going anywhere.
I had an aneurysm in my aorta. A nurse called me and said, be prepared, Don, that you need open heart surgery. I said, well, that word scares me. And she goes, sounds barbaric, doesn't it? It does sound barbaric. You know, they're gonna break your chest. They're gonna be in your chest. It's invasive.
Cardiac surgery is a very invasive procedure. It used to be a substantial hurdle getting over the first 4 to 6 weeks.
The biggest concern I had is the pain level. And he showed me what they do. He goes, what do you think of it? I said, count me in.
He gave me a quick explanation. I said, give me the paper, I'll sign now.
Cryo Nerve Block is freezing or ablating the intercostal nerves on either side of the sternum, which usually provides substantial pain control for up to as long as 2 months after surgery. By that time, they've healed, the bone is healed, and they shouldn't have any pain at that point because they should be fully recovered.
My pain level from 1 to 10, I was never over a 4. And I'm not a tough person by any means.
If I walked through the intensive care unit, even on the night of surgery or post-operative day 1, I could tell which patients had had the nerve block and which ones hadn't. The nurses in the ICU are able to get the breathing tube out faster, so they're able to get them up and moving a little bit more. The earlier they mobilize, the earlier they can go home, the earlier they can return to more normal activity. Now that we're using a variety of different modalities, with cryo nerve block being a very important one in my practice, we're not dealing with that transitional pain so much.
I went back to work after out 27 days. Just giving me capability again and getting back on track quickly.
Gotta have your life back.
Yeah, feeling alive again and feeling good.
This process that they've come up with has made my recovery 1,000 times easier. It's definitely something I would suggest in a second.